Here are 5 things I'd never do to my teeth as a dentist, and some of these habits may seem to be healthy, but they actually weigh down your enamel, irritate your gums, and harm your overall health. And in this video, I'll show you exactly what I'd avoid and also what I do instead to protect my teeth for as long as possible. So let's get to the first one. And this might sound basic, but I never skip cleaning my tongue. And I'm also willing most of the people that watch this video do. So here's the thing. Your tongue isn't just a smooth muscle that's sitting in your mouth. If you look at it under a microscope, it's covered in tiny bumps called papilla. And think of them like microscopic valleys and hills. And these valleys, they're like the perfect hiding spots for bacteria, food particles, dead cells, and it's like having a thick carpet in your mouth that really never gets vacuumed. And here's what's living on your tongue right now. So you have hundreds of different bacterial species, food debris from everything you've eaten, dead cells that your mouth naturally shed, and also proteins that the bacteria naturally feed on. So this creates what we call a biofilm, and it's like a bacterial city with its own ecosystem. And here's the problem. Most of the people that brush their teeth religiously but completely ignore their tongue, so their teeth might be clean, but their tongue is harboring millions of bacteria that immediately recolonize their freshly cleaned teeth. And it's a bit like mopping a kitchen floor but leaving a pile of dirt in the corner. So that dirt is just going to come back and spread across your clean floor. And this is what this leads to. So it can lead to a bad breath that comes back within hours after brushing. It can lead to a higher risk of cavities and gum disease. It can lead to an altered taste. So that coating can actually dull your ability to taste food properly. And it can also lead to oral thrush and other infections, especially if your immune system is already compromised. And here's what I would do instead. So I clean my tongue every single time I brush. So twice a day minimum. And I use a tongue scraper and not a toothbrush because scrapers are way more effective at removing the biofilm. And I start from the back of my tongue and I scrape 3 to 4 times, and then I would rinse between the scrapes so I'm not just moving bacteria around my mouth. And your tongue actually holds about 60% of the bacteria in your mouth. And number 2 is I never sip acidic drinks slowly. And this one actually surprises a lot of people because we're told that lemon water is healthy, kombucha is good for your gut, and sparkling water is better than soda. And people are not wrong about the health benefits, but the timing here matters than what most people realize. And your mouth sits naturally at a pH of about 7.4, which is slightly alkaline. And when you drink anything acidic, so lemon water, which has a pH of about 2.5, kombucha has a pH of about 3.5, and sparkling water has a pH of about 4.5. Your mouth basically, or your mouth's pH plummets below the critical pH of 5.5. And at 5.5, your enamel starts to demineralize, literally dissolving. And here's the part that blew my mind when I first learned it. So the acid attack doesn't just stop when you take your last sip. It can actually last for 30 to 40 minutes after your last sip. So if you're sipping lemon water throughout your morning routine or kombucha during your afternoon work session, you're basically keeping your teeth in a weakened state, in an acidic state, and that leaves them vulnerable for hours on end. And think about it this way. If you take a sip every 10 to 15 minutes, your teeth never get a chance to recover, and your saliva never gets an opportunity to neutralize the acid and start the remineralization process. And it's like repeatedly poking a bruise before it can heal. So here's what I would do instead. I drink acidic drinks only with meals. That's because that's when the saliva production is usually the highest. And I also try to finish the drink within 15 to 20 minutes rather than sipping it slowly over hours. And I make sure I rinse with plain water afterwards to help neutralize acid. And also I wait for at least an hour after I finish drinking before brushing, because if you brush after you have something acidic right away, you're actually doing more damage than good. And here's the thing. If you really need to drink that lemon water every day or the apple cider vinegar, I would try and use a straw and try and position it towards the back of your teeth to try and minimize contact with your teeth. And here's something most people don't realize. Your saliva is incredibly powerful because it contains minerals that can actually repair early stages of enamel damage, but only if you give it the right conditions and if you actually give it a chance and not constantly bathing it with acid. And number 3 is I never use an alcohol-based mouthwash. And you know that burning sensation that you get when you use a mouthwash? So a lot of people think it's working, but what it's actually doing is it's working against you, because most commercial mouthwashes contain 15 to 25% of alcohol, and that's stronger than most wines. So here's what the alcohol is really doing in your mouth. So it strips away the protective mucin layer in your gums, it kills the good bacteria along with the bad ones, and it reduces the saliva production, and it also can make bad breath worse in the long term. So your mouth isn't just a simple cavity that needs to be sterilized. It's a complex ecosystem with delicate balance of bacteria. So you want to reduce the harmful ones, but you don't want to destroy the good ones. Because the good ones can actually protect you against infections and can help maintain a proper pH. And the research on this is pretty clear because most alcohol-based mouthwashes can disrupt this balance, and that can lead to a chronic dry mouth, which reduces your natural defenses. It can actually cause more cavities because you have less natural saliva protection. It can cause persistent bad breath because you've disrupted the bacterial balance, and it can even cause mouth irritation and sores in some people. Now, here's what's particularly frustrating because the marketing makes you feel that you need to burn to kill germs, and most of the effective antimicrobial ingredients don't burn at all. So here's what I would do instead. I would use a xylitol or a fluoride-based rinse a few times a week because the xylitol can starve the harmful bacteria without killing the beneficial ones, and fluoride helps remineralize early tooth decay. And most days, to be honest, I skip using a mouthwash or a mouth rinse if I've brushed and flossed properly. And studies show that xylitol can actually reduce cavity-causing bacteria by up to 75% without any downsides of the alcohol. Plus, it also stimulates the saliva production instead of reducing it. And here's a key point. So, effective oral care doesn't have to hurt. If your mouth care routine is painful or leaves you with a dry mouth, you're probably doing something wrong. And number 4 is I never skip cleaning between my teeth. And this is where most people fall short, and honestly, I get it. Flossing feels like a chore, but here's the reality. Even the most thorough brushing only gets about 60% of the tooth surface. So you have the other 40%, which is in between your teeth, and it's in those tight spaces where your toothbrush bristles cannot reach. And here's what's happening in those neglected spaces. So food particles get trapped and stuck there, and then the bacteria feed on those particles, and then they multiply, and then they produce acid as a waste product, and that sits directly against your enamel, and then that acid basically has nowhere to go. So it just sits there and it starts dissolving your enamel. And this is exactly the reason why a lot of people have cavities in between their teeth, even though they brush religiously twice a day. And it's not just about cavities. These same bacteria can also irritate your gums, which can lead to inflammation, bleeding, and eventually gum disease. And the technique matters more than just the tool. So most people floss wrong. They just snap it in between their teeth and they call it done. But effective flossing means going below the gum line and not just the visible parts of the teeth, and curving the floss around each tooth in a C shape and moving it also up and down rather than just sliding it side to side, and using a clean section of the floss for each space. And here's what I do personally. So I floss each and every single night before brushing. So this sequence actually matters because flossing loosens the debris and the bacteria, and then the brushing basically sweeps it all away after. And for wider spaces, especially in the back of my teeth, I use interdental brushes because these are more effective than a traditional floss. And I sometimes use a water flosser as well, but that's just as a supplement and not a replacement for actual flossing. And here's a quick reality check. So if you're just starting to floss, and your gums will probably bleed for about a week, and that's totally normal because that's inflammation from built up bacteria that's finally being disturbed. And after that adjustment period though, if you still notice bleeding after when you floss, then that's something that might need a bit of attention. And here's the thing, I'd rather spend 2 minutes every night flossing than end up spending hours in a dental chair having cavities filled or gum disease treated. And this leads us to the next point. And number 5 is I never ignore bleeding gums. So this is one of those things that I wish more people took seriously because it gets overlooked far too often. And I commonly hear patients say, my gums bleed when I brush, I must be brushing too hard. And let me be crystal clear about this. Healthy gums should not bleed ever. And if your gums bleed when you brush or floss, that's not normal wear and tear. That's your mouth's alarm system going off. And bleeding gums are a sign of inflammation. And inflammation is a sign or is a response to a bacterial infection. And it's also usually the very first sign of gum disease. And here's why this matters. Because these bleeding spots are like tiny doorways that allow bacteria to enter from your mouth to your bloodstream, and from your bloodstream they can travel to other parts of your body. And the research or the link of gum disease to the rest of your body is pretty shocking because it's been linked to a 40% increased risk of heart disease. It can double the risk of stroke. It can lead to complications with diabetes. It can increase the risk of Alzheimer's disease, and it can also lead to pregnancy complications and preterm births. So the progression here happens in predictable stages. So we have gingivitis, which is usually the first stage of gum disease, and that's when we have bleeding and inflammation. And this stage is completely reversible. And if that doesn't get treated, it can lead to early periodontitis, which means that the infection spreads below the gum line and you might have a bit of bone loss as well. That's where it begins. So this stage is usually manageable, but it isn't reversible. And if that doesn't get treated, it can lead to advanced periodontitis. And that's when we have significant bone loss, loose teeth, and even possible systemic health effects. And the key insight that most people miss is you want to catch this at the gingivitis stage when it's still reversible. So here's what I would do if I notice any bleeding in my mouth. Now, I wouldn't just brush gentler, I'd brush smarter. So what I mean here is I would use something known as the BAS or the modified BAS technique. So I would angle the toothbrush bristles at a 45-degree angle towards the gum line, and I would brush in small, gentle, circular motions. And the goal here is not to just clean the teeth, but also to clean the pocket, basically where the plaque tends to build up right at the edge of the gums. And I try to go section by section, so the inner surfaces, the outer surfaces, and the chewing surfaces. And the goal here is to never rush it. It's not about scrubbing hard, it's about being consistent and deliberate twice a day, every day. And here's the counterintuitive part. Bleeding gums usually mean that you need to clean more and not less. So the bacteria that are causing the inflammation need to be physically removed. And many people make the mistake of backing off whenever they see blood, but that's just making the problem worse.